Am I audible to all of you?
Yes, ma'am.
Okay. So pigmentation of skin is our today's topic, and this is the most common concern which your patient will come across in cosmetics. Okay, so we have different type of hyperpigmentation, and you can treat it through medications also, but only medication is not going to give that result fast. So you need to give cosmetic treatments as well. So, like normal cells, it contains cells called normal skin contains cells called melanocytes, and these cells produces melanin. So, the substance that gives color to the skin. So, skin with too much melanin is called hyperpigmented skin. Whereas, on the other hand, when the skin becomes lighter at certain places, then it is known as hypopigmentation. So, in cosmetic, we will be dealing with the hyperpigmentation, right? So, pigmentation disorders are disturbance of human skin color, either loss or reduction, which may be related to loss of melanocytes or the liability of melanocytes to produce melanin or transport melanosomes correctly. So melanin, it's a Greek word. Melas means black or dark. It is a broad term for a group of natural pigments found in the most organism. Melanin is produced by the oxidation of amino acids tyrosine followed by polymerization. So the melanin pigments are produced in a specialized group of cells known as melanocytes, and these melanocytes are found in the germinative layer of the epidermis. Melanin is an effective absorbent of light. The pigment is able to dissipate over 99.9% of UV radiation. Because of this property, melanin is thought to protect skin cells from UVB radiation damage. Now there are two types of melanin we have. So eumelanin that mostly makes dark colors in hair, eyes, and skin, and pheomelanin colors the pinkish parts of the body like lips and nipples. So, hyperpigmentation is the darkening of an area of skin or nails caused by increased melanin. Okay, so there are multiple causes of this hyperpigmentation, right? So, whenever you are doing the consultation, just try to find out the exact cause. Now, genetic, so pigmentation disorder, it can be hereditary or it can be acquired, right? And have many causes, including like abnormalities in the melanoblast migration and melanosome development or transfer, or even changes in the numbers of melanocytes, right? Or uh, defects in melanin synthesis. So during this pigmentation disorders, it can be hereditary or acquired during the synthesis, like during the melanin synthesis itself. Then excessive sun exposure. So sun exposure is the number one cause of hyperpigmentation, right? And it is the sunlight that triggers the production of melanin in the first place. So just try to like ask your patient how much they spend time under the sun. Like if direct sun exposure is there, then the skin must be tanned and very much hyperpigmentation. So you have to give the treatment accordingly. Then certain chemotherapy, it can also leads to hyperpigmentation, right? The cause of side effects is currently unknown, but it may involve direct toxicity, stimulation of melanocytes, and also inflammation. So chemotherapy therapy can also lead to hyperpigmentation. Certain medical conditions, right? So this one, acanthosis nigricans, hyperthyroidism, okay, obesity, diabetes, these medical conditions can also lead to hyperpigmentation in certain parts of the body. Okay, like because of obesity, the skin also gets pigmented because of the friction, right? In hypothyroidism patient, the skin gets dry, right? So in dry areas also, the dry skin also tends to get darkened over certain period of time. So these are like medical conditions are also they can cause hyperpigmentation. Then allergies, so allergies from certain medications, right, or even some products like cosmetic products can also lead to hyperpigmentation. Allergic shyness or periorbital hyperpigmentation, right, that is because of sinus. So sinus congestion can lead to this periorbital hyperpigmentation. Okay, they tend to like the eye, this the eyes area, mostly the upper eyes, they tend to be bluish purple. Okay, and it is often accomplished by red, itchy eyes, sneezing. Okay, because of the sinus pressure and a sore and itchy throat. So this can lead to periorbital hyperpigmentation. So whenever you see any sort of this dark eyes or under eye dark circles, so you have to take proper history of your patient, right. Dark circles, it is difficult to treat, but because it is related to many conditions, right. If the person is in chronic stress, if the person is having disturbed sleep, inadequate diet, so multiple reasons can lead to under eye dark circles. Those who spend a lot of time, like screening time is more, so in that case there will be hyperpigmentation around eyes. Okay, and this is like periorbital hyperpigmentation. It can because of this sinus congestion, right? Then chemical or physical injury. So prolonged use of any cosmetic products can lead to hyperpigmentation. Okay, and hyperpigmentation resulting from any skin inflammation, it is called post-inflammatory hyperpigmentation, right. Suppose if a person develops acne, then once the acne gets healed, then it can lead to PIH, post-inflammatory hyperpigmentation, like blemishes would be there. In some cases there will be no marks, no blemishes, but in few cases there would be post-inflammatory hyperpigmentation. Okay, and the same you will see in a patient who got injury or cuts or burns like something. So once the skin gets healed also, but again when you see that area or that patch, then there would be discoloration. So that is also post-inflammatory hyperpigmentation. Okay. Then obesity, diabetes, hormonal causes. Hormones can influence particular kind of hyperpigmentation known as melasma. So melasma, you must be knowing about melasma. That is the most common type of hyperpigmentation, which is like because of hormonal causes, and it is also because of excessive sun exposure, right. But in females, it is mostly because of hormonal issues. We'll be discussing in detail right now, like after this causes, about this melasma. Okay. Then aging. So aging, it also leads to age spots, and in some individual, the skin gets darker as they age. Certain ethnic causes. Okay, it is common among Indian and Asians due to our genetics that our skin gets hyperpigmented. Then repeated contact with cosmetic products. So definitely prolonged use of certain products can lead to darkening of the skin. Constant scratching or other minor trauma to the skin. Stress, it can lead to this dark circles. Then friction and pressure, irregular sleep, disturbed sleep, and inadequate sleep. So these are the causes of hyperpigmentation. So after analyzing the type of hyperpigmentation, you need to ask the history of your patient. Okay, all the histories you should take. When that hyperpigmentation started, like the duration and what all medications the person is taking. They might not tell you because they think that it is not related to certain medications or something, but still you have to ask. Okay, like knowing about the root cause is very important. If the person is not taking right diet or having any sort of nutritional deficiency, then it can also lead to hyperpigmentation around the mouth. Okay, this one. Overall face, you will see there would be dullness on the face. If the person is not properly hydrated, then it can also lead to darkening or basically the dull skin. Okay, so just try to find out each and everything. Okay, ask as many questions as you can to your patient during the consultation, right? So these are the different causes. Now, different types of hyperpigmentation. So melasma, freckles, age spots, tanning, patchy pigmentation. Melasma is a common skin problem, causes dark, discolored patches on the skin. It is also called as mask of pregnancy when it occurs in pregnant women. It typically occurs on the face and is symmetrical with matching marks on both the sides of the face. Okay, so this is melasma, right? It is like butterfly shape, and it occurs mostly during pregnancy. And in few women, it is like it disappears after the like after pregnancy, like after few months, it reduces by its own. But in few women, it does not reduce. So in that case, you need to give treatment. Okay. And during menopause also you will see this type of hyperpigmentation, because melasma is related to hormonal issues. Okay. And also those who have spent a lot of time under sun, direct sun, if direct sun exposure is there, and if the person is not applying sunscreen or not protecting their skin, or physical protection is not there, then also it leads to hyperpigmentation or melasma. Right. And it is most commonly seen in women, and on darker individual, those who have darker skin tone, then there is more number of melanin. Right. So these are the like signs which you can see. So mostly found in female. Okay. And it is related to hormonal causes. And if like in it starts in small patches. Suppose it occurs on cheek, and both the cheeks are involved, and it also occurs on the entire face. Those who have severe melasma, then they like nose area is also involved, forehead is also involved, chin area is also involved, and the entire cheeks are involved, right? So in like that is the severe case, and it takes time to cure. Whenever you are doing any cosmetic treatment also, so it definitely need multiple sessions, right? If you're doing chemical peel or any facials, laser treatments, so multiple sessions are definitely required depending on the condition or the severity, right? So if it is like in small patches, then you can do chemical peel or your facials, whatever you are going to learn in upcoming chapters. So melasma is like difficult to treat, and it takes time basically. Okay, it is not like that it cannot be treated. It can definitely be treated, but it takes time, right? And it also depends like for how long this melasma has been there, right? So darker skin individuals are more at risk than those with fair skin. Is it clear to everyone? So those who are practicing, have you seen this type of patients, or have you treated? And it is also called as mask of pregnancy. It is like butterfly shape, right, on both the cheeks. Similar pattern is there on both the cheeks. Okay. Then we have freckles. So freckles are small brown spots on the skin, often in areas that get sun exposure. Freckles are harmless. They form as a result of overproduction of melanin. This tends to be most common amongst people with lighter skin tone and hair color. Right. So those who have fair skin, they tend to get freckles. Okay, you must have seen also, like, and if you have not seen, then you can start noticing, right? Those who have fair skin, they develop this freckles. These are brown spots. Okay, these are harmless. There's no pain or nothing is there. Only this brown spots are there, which are bigger in size than a mole. Okay, in some freckles are even smaller, but you can easily identify like between moles and freckles, and it occurs in fair individual. Then we have age spots. Age spots are small, flat, dark areas on the skin. They vary in size and usually appear on areas exposed to the sun, such as face, hands, shoulders, and arms. Age spots are also called as sunspots. So you can see here, these are the age spots at the person age, then they develop these age spots. So age spots are very common in adults older than 50 years, but younger people can get them if they spend time in the sun. These are flat oval areas of increased pigmentation. They are usually tan to dark brown and occur on the skin that has had the most sun exposure over the years, ranges from freckle size to about half an inch, and it can also group together making them more visible. Okay, so these are the grouped age spots. Then tanning. So tanning is the process whereby skin color is darkened or tanned. It is most often as a result of exposure to ultraviolet radiation from sunlight or from artificial sources such as tanning lamp found in indoor tanning beds. Exposure to UV rays causes certain skin cells to produce the pigment melanin, which darken through oxidation. The pigment absorbs UV radiation and defends against further penetration of skin tissue and skin burn. So this is the tanning. Because of watch this area, it has not been involved in tanning. So you must have also experienced this tanning, right? So this is also a type of hyperpigmentation. Now, how to diagnose? So taking proper history of problems like onset, any medication, any reaction to product, what type of skincare products are used, exposure to sun or chemicals, health problems including hormonal changes. Okay. Then observation under normal light. Observe type of pigmentation and the area of pigmentation. Through dermoscope, you can also see the type of pigmentation. Okay. So basically these are the different types of hyperpigmentation and all are different. So you can easily identify the type of hyperpigmentation. The severity and everything, the causes you will get to know after taking the history. Right. So, cosmetic treatments you can plan. Like whenever you plan for the cosmetic treatment, minimum you should give 3 sessions. Okay, of any of the procedure. You will be learning about different type of facials, laser treatments, PRP, mesotherapy. So, whatever treatment you are planning for any of the concern, then minimum 3 sessions are required, right? And maximum 6 sessions at one stretch. And after like that, after if you give to any give like to give any of the maintenance session, or if the maintenance sessions are required, then that also you should inform your patient. Okay, but for any of the cosmetic treatment, only one session is not going to help them. So minimum 3 sessions you need to give. Now, while treating the type of hyperpigmentation, you should know the type, okay, the severity, and then you can plan the treatment and you can inform your patient. Okay, because what like the correct way to treat any of these condition is to give sessions, right? So try to give packages. Like if you are treating melasma, then you can tell or inform your patient that they need to take that much of session or something. So always try to give or plan your treatment in number of sessions in packages, right? So you can combine your treatment, like you can do chemical peel, you can do medifacial, hydrofacial, laser treatments. So it will it will be decided once you see the patient, right? So the point is you need to give multiple sessions, and the type of treatment will depend on the same day that what you are planning to do. after seeing the actual condition. Okay, so if you want to treat a type of hyperpigmentation, then your treatment option would be chemical peeling. That is the best way to treat any sort of hyperpigmentation. We have multiple types of chemical peels available, right? So chemical peel is one of the choice. Then you can do medifacial. Okay, you can do carbon treatment. So even hydrofacial can be done for superficial hyperpigmentation, right? So the thing is, you can plan your treatment and multiple sessions are required. And along with that, like if you do any cosmetic treatment and if the person is or the pigmentation is related to any sort of medical condition, then you have to treat simultaneously. Like only your cosmetic treatment is not going to help the patient. So along with your cosmetic treatment, you should give your internal medications also, being a homeopathic practitioner. So if the person is ready to take the treatment, you can give the medications also. And if the patient is taking the treatment from somewhere else, then that is also fine. But the thing is, they should take the medical treatments. Okay, they should take any of the medications to treat that issue. Okay, and along with that, you have to give cosmetic products also. Like some serums are there, right? Serums are very effective in treating hyperpigmentation. It will take time, but it will definitely like reduce all those type of hyperpigmentation. Okay, so topical creams or treatments, it is very important along with your cosmetic procedures. Okay, so we have also included certain types of ingredients which are skin lightening agents, and you should know about those ingredients, right? Because you have to give some sort of serums to your patient, and patient would also ask you, because today nowadays everybody is very much familiar about the serums and some sort of creams, some skin lightening agents. So you should know about the ingredients, what all there are, like what all ingredients which are there in the market. Okay, and what all effects they are providing, the side effects, the advantage, everything you should know. So there are few topical skin lightening agents. Number one is hydroquinone. So hydroquinone, it bleaches the skin by decreasing the number of melanocytes present, used to lighten the dark patches of the skin, also known as hyperpigmentation, melasma, age spots and freckles caused by pregnancy, birth control pills, hormonal medicines, or injury to the skin. The medicine works by blocking the process in the skin that leads to discoloration. Right. So this hydroquinone, it is really an effective ingredient to lighten the skin, right? But the thing is, it also has many side effects. But if the patient is having severe this one melasma, right? And they are like, some patient, they will tell you that I've tried multiple things, but the pigmentation is not like reducing, right? So in that case, if you want, you can also recommend this hydroquinone. But yes, there are side effects, so you have to tell your patient that it can be used only for 2 to 3 months, not more than that. Okay, so you can give this if you want to, and it can only be used in 2 to 4% formulations. That when you see the packaging, so initially give only 2% of hydroquinone, not more than that. Person will get result through this only. If that is like if 2% is also not helping the patient, then you can give 4% formulation. Okay, but yes, it should be like applied very carefully, and the person has to like they don't have to use for a longer period of time, because there are many side effects. It will definitely lighten up those hyperpigmentation, right? But the thing is, it will also make the skin thin, and there would be a redness, sensitization. The skin becomes very sensitive at that part, okay, where the person is applying, dermatitis, dryness and redness. So, and also it is very important to recommend sunscreen whenever the person is they have to use this hydroquinone at night, and they have to apply a sunscreen in the morning. That is must. Okay, so it has side effects. So generally, it is not the safe ingredient, but under the observation of like doctor, you can ask your patient to, if you think that the person requires, then you can recommend in 2%. Okay, but I would not recommend to advise it to all your patients. Only if severe melasma is there, and if the person is not getting result through any of the ingredients. Okay. Then we have the second ingredient called retinol. So it is also called vitamin A. Retinols reduces fine lines and wrinkles by increasing the production of collagen. They also stimulate the production of new blood vessels in the skin. And side effects. So retinol will basically it will help in uh, increasing the cell regeneration. Okay, so retinols will help in treating fine lines and wrinkles, and it will boost up the collagen production. So those who are above 30, or those who have fine lines and wrinkles, premature age patient, you can give retinol, but there is a certain way to use retinol. First of all, it should be applied initially. If the person has not used this retinol earlier, then they should apply it once a week. Okay, like start applying once a week, only in pea sized amount, or twice a week, only in pea sized amount, and on clean face. First of all, they have to wash the face and then apply this retinol. So it is again available in cream form. In pharmacy also you will get retinol, right? So only in pea sized amount they can apply on the entire face, and only twice a week, or they can start from once a week or maximum twice a week for the beginner. Once they see no side effects or no excessive burning or something, then they can apply alternate day. Okay, and it should be applied only during night time. And in the morning, it is compulsory to use sunscreen. So this is the way we should incorporate retinol to our skin, right? In pea-sized amount, night time, and maximum alternate day, right? Every day we should not apply retinol. So this is why a lot of side effects. The more retinol you put on the skin, the poorer the barrier function becomes. This is why a lot of people feel that their skin is very sensitive and experience peeling, flaking, and irritation. Used in concentration of 0.01% to 1%. Right. So this is the concentration which you should start. And but retinol, it does not have side effects. It is a very good ingredient for those who are having fine lines and wrinkles. Okay. Then azelaic acid. So azelaic acid is a tyrosine inhibitor, meaning it can prevent hyperpigmentation because it interferes with melanin production. Right. So azelaic acid is a tyrosine inhibitor. It is an anti-inflammatory for the acne, and it is anti-pigment because it blocks triosinase, the enzyme which is responsible for producing pigment. So its results will be seen after 3 to 4 months, used in 15 to 20%, more effective when used with glycolic acid 15 to 20%. So azelaic acid is the safe ingredient. It is the safest one. So if during pregnancy, if your patient requires any of the skin lightening agent, or normal moisturizer or serums, then you can recommend azelaic acid. It is safe during pregnancy also. Rest other ingredients we should definitely avoid, retinol and everything. But azelaic acid, it is safe, so you can recommend this one, but it should be used in 15 to 20% only. The percentage you should remember. Okay. And it will help in reducing the type of it will help in producing that glow to the face also. And all retinol, azelaic acid, always try to apply, if you are using this, only azelaic acid or retinol, then always use at night. Okay. If you are applying any of the ingredients like retinol or sorry, azelaic acid, which is there in the moisturizer, like which is added in with other ingredients, then you can also use during daytime, right? But if you are using purely azelaic acid, then always apply during nighttime. Side effects: skin sensitivity, dryness, tingling, a burning sensation, redness, or peeling. So, after this, applying this retinol or azelaic acid, the skin becomes sensitive. So, if you suppose if you have applied retinol or azelaic acid and you feel little bit burning and tingling sensation, then on the top of that, you can apply moisturizer also. Okay, so that is fine if you are applying moisturizer after azelaic acid or retinol. And a morning sunscreen is must. Then kojic acid. So kojic acid inhibits and prevents the formation of tyrosine, which is an amino acid that is needed to produce melanin. Kojic acid can give a skin lightening effect, used in 1 to 4% in the form of cream or gel. So kojic acid is also a safe skin lightening agent. So if you want to treat melasma or uneven skin tone or any sort of blemishes, then you can give these things, these skin lightening agents, because you know the work, what it is doing to the skin, right? Side effects contain contact dermatitis is the most common side effect. It can be manifest itself as redness, irritation, itchiness, rashes, swollen skin, or pain and discomfort. But these are not the common side effect. These are the rarest one. Okay, so every patient, every person, they does not give they does not develop these side effects. Then we have niacinamide. It is an effective skin lightening compound that works by inhibiting melanosomes transfer from melanocytes to keratinocytes. It is derived from vitamin B3. It helps build keratin, a type of protein that keeps the skin firm and healthy. It helps in pore minimizing, retain moisture, regulates oil, and protects against sun damage. Treats hyperpigmentation, minimizes fine lines and wrinkles. So you can see the benefits of these niacinamide. So it is very effective in pore minimizing. Those who have enlarged pores, you can recommend niacinamide serums. These are all the ingredients: kojic acid, niacinamide, vitamin C, hyaluronic acid. These are available in serums, right? And serum, it takes time, like 4 to 6 weeks. It takes time to show the difference, but it will definitely make the difference, right? So the person has to use it regularly. Nighttime skincare is very important, right? And they have to be consistent, and they will get the difference, like they will definitely see the difference. And along with this, you can give cosmetic treatments once in a month. Used in 2 to 5%. Side effects: niacinamide is possibly safe. Cream might cause mild burning, itching, or redness. Then vitamin C, it plays an important role in maintaining skin health and can promote the differentiation of keratinocytes and decrease melanin synthesis, leading to antioxidant protection against UV-induced photo damage. Fading dark spots and lightening hyperpigmentation, used in 5 to 20% for skin brightening. So multiple vitamin C are available: 5%, 10%, 15, and 20%. Side effects very rare, but few may get itching, redness, skin irritation, and tingling sensation. Okay, so if the person is having dull skin or pigmented skin or blemishes, then you can recommend a vitamin C. Then we have hyaluronic acid. So it hydrates and plumps the skin by drawing in moisture, which can improve its texture, firmness, and elasticity while reducing the appearance of lines and wrinkles. right? So it will basically make the skin hydrated, and those who have fine lines and wrinkles, they will also see the difference. It also supports skin moisture barrier and can aid in wound healing. Okay, so these are the important ingredients which you should definitely remember. And also, like, few ingredients like hyaluronic acid, vitamin C. Nowadays in moisturizers also, it is combined. So when you see the ingredients, okay, suppose any of the moisture, it claims excessive hydration, or along with hydration it gives glow to the skin, then just see the ingredients. You might see any of these: vitamin C, or kojic acid, alpha arbutin. Alpha arbutin is also one of the ingredient which help in lighten the hyperpigmentation. Okay, so there are different works of different products. Sunscreen will protect the skin from the harmful rays of UV radiation. Okay, so it does not give any skin lightening effect or something, but it will only protect the skin through those harmful effects. Then moisturizer. So moisturizer will help in locking up the moisturizer, like normal moisturizer of the skin, and it will hydrate the skin, right? Then we have toners. So toner will help in just toning up the skin, and also it will shrink up the pores, it will give the cooling effect to the skin. Then we have the serums. So serums are customized. Okay, serums are something which acts as a treatment to your skin. Okay, so if whatever the concern of the patient, you can give the serums accordingly. And one or two serums a person can apply on a regular basis. Suppose morning they are using hyaluronic acid serum, then night they can use vitamin C serum. Okay, like that the person can incorporate all, like, the serums in their skin. Is it clear to everyone? If you have any doubt, you can ask. Then machine treatment. So microdermabrasion, chemical peel, and medifacial. These are the cosmetic treatments which you can do for hyperpigmentation. All the treatments we are going to learn in detail. Okay, just remember the treatments. We can do microdermabrasion, we can do chemical peel. Again, in chemical peel, we have multiple peels. So you will be learning in detail about all the different peels. Okay, I'll discuss about medifacial also in detail. So these are the treatment options. Now, the basics of Fitzpatrick scale. So, in like last lecture, we have learned about the different skin type, like type 1, type 2, type 3. Sorry, a different skin type, like um, whether the skin is oily, dry, or mature skin, combination skin, like this we have learned. Now there is again different type of skin according to the Fitzpatrick scale. So uh, we have six different type of skin worldwide, right? Initially developed by Thomas Fitzpatrick in 1975, MD of Harvard Medical School. The Fitzpatrick scale system includes six specific skin types and ranges from very fair skin to very dark skin. So Fitzpatrick scale, it is according to the pigmented, like lighter skin to darker skin, according to the shade of the skin. So said skin types include six different types. Type 1 is very fair skin, type 2 is fair skin, type 3 is medium skin, type 4 is olive skin, type 5 is brown skin, and type 6 is black skin. So the Fitzpatrick test is based on two primary factors. First, your skin's reaction to sun exposure, and the second one is genetic disposition. So these are the two important factors through which we get the skin tone. Okay, and the area also, like where we are living. So the reaction to sun exposure and the genetic disposition. Put simply, those with skin type 1 and 2 are higher risk at photo aging and skin diseases, including cancer, while those with skin type 5 and 6 are at a much lower risk of developing such conditions. Okay, because of the melanin present in the skin. However, it should be noted that premature aging from sunlight can affect people with all skin shades, especially if they spend a considerable amount of time outdoors and receive excessive levels of UV exposure. On the Fitzpatrick scale, those with type 1 skin have the least amount of melanin present in their bodies, while those with type 6 have the most melanin, which is why they are either more or less likely to develop harmful skin conditions. Okay, so these are the different skin type. Type 1, the skin color would be light and pale white, and the sunburn, like they always burns, but it never tans. Skin type 2, white and fair, usually burns but tans with difficulty. Type 3, medium to olive and sometimes burn, gradually tans to olive. Type 6, beige olive, moderate brown, and they rarely burns. And tanning, like easily tan to moderate brown. Type 5, brown and dark brown, very rarely burns, tans very easily. And type 6 is very dark to brown, never burns and always tans. Now, this type of skin color or the skin type you will see in laser machine. Whenever you will switch on the laser machine, you will see the Fitzpatrick scale. Okay, so according to the skin condition or the color, you need to select the type of your skin. And the type 1, like when you see type 1 albinos, mostly albinos and some redheads, they come under the skin type 1. Then we have type 2. So people of northern European origins, okay, such as Scandinavians, they come under skin type 2. Then skin type 3, people of Mediterranean and Middle East origin, they come under type 3 skin type. Type 4, people of East Asian origin, such as Chinese and Japanese, and also some Indians and Pakistanis, they come under type 4. And type 5, people of African origin and Southeast Asian. Some Indians and Pakistanis also come under type 5. Then we have type 6, that is dark brown. So people with blue black skin of African origin. Okay. And they have dark skin tone. And also some Asians, such as Tamilians, come under this skin type 6. So 1, 2, and 3, we Indians don't come under this type of skin. We come under 6. A few individuals like some Kashmiris, the northern areas, they come under this type 3, but mostly we come under 4 and 5 category. Right. So you just have to select the skin type between 3, 4, and 5. And also, some chameleons come under this skin type 6. So before starting your treatment or before setting up the other parameters, you need to select the skin type. So according to the skin Fitzpatrick scale, the skin is divided into 6 types. It is basically the shades. Okay, because when we do the laser treatments, so it will target the melanin. Okay, so that is why it, we have to select the skin type, more number of melanin, less number of melanin, accordingly further settings would be there. Okay, is it clear to everyone? So this is about all about the hyperpigmentation. If you have any doubt, you can ask, or else I'll end the lecture. Okay, thank you so much, everyone. I'm ending the lecture here.